Welcome to Medical Minutes here on Time Warner Cable DMG TV2. This show will surround all about diabetes. We are talking about a specific program that's coming up through Union Hospital, which is why we are here at the Community Health and Wellness Center for Union Hospital. We're going to speak with Debbie Angel and Beth Hoffman on how to manage your diabetes and a free program that's coming up. Then we're going to talk about your feet. Because it is time to go back to school, we want to make sure you pick the correct shoes and how we can avoid problems with your feet that can accompany diabetes. All coming up on Medical Minutes.
A nursing home or your own home? It's good to be home, so call Ember Complete Care for all your home health needs. When you're recovering from illness or injury, our compassionate staff promotes healing in the most comfortable environment of all, your own home, for skilled nursing, physical therapy, wound care, and more. Locally owned and operated, Ember Complete Care has been servicing all of Tuscarawas and Coshocton County since 1986, with a yearly average of $75,000 donated back into the community. Call 1-800-462-0909. Ember Complete Care. It's good to be home.
Myers & Miller Podiatry provides complete foot and ankle care to patients of all ages. The practice was established in 2000 by Dr. Adam Myers and has grown to include Dr. Andy Miller in 2007 and most recently Dr. Jason Backage in 2010. Our core values of respect and honesty are the basis for how we manage our practice, and we have grown by building relationships with our patients in order to better serve their needs. Myers & Miller Podiatry serves Tuscarawas and Holmes County with offices in Dover, Sugar Creek, Newcomerstown, and Millersburg. Let's get started building our relationship.
Welcome to Time Warner Cable DMG TV2's Medical Minutes. I'm Jennifer Clark, and today we are on Oxford Street in Dover, right outside Union Hospital's Community Wellness Program. With us today are the nurses who run that program, Debbie Angel and Beth Hoffman, and they have a special program coming up that we'll get into some detail in a little bit. It's about diabetes self-management. Now, Debbie, I'm going to start with you, and I want you to explain to me, what is diabetes?
Well, Jennifer, diabetes has really been on the increase the last years in the community with, everything is bigger sizes when you go out to eat, portion sizes, increase in BMIs and weights. So diabetes affects people because some individuals need to be on insulin, some just on oral diabetic medications. It can affect their kidneys, all their different organs, their eyes, and can eventually cause death if it's not controlled.
And diabetes is when your insulin is out of control because your pancreas creates insulin and it's a reaction to sugars and carbohydrates, right?
Absolutely, yes.
And so does that happen to everybody? You can't control it?
Well, sometimes there's a genetic component, but through diet and exercise and taking care of yourself, watching what you're eating, you can manage. If you have diabetes in your family, you can try to control it. Some people have been known to reverse the symptoms, if they've lost a lot of weight and everything. So everybody's different.
So is it only weight and diet?
Genetics play a big part of it also, unfortunately.
And there are a couple of types of diabetes. There's diabetes that you can manage through diet and exercise, but some need to actually inject insulin, right, Beth?
That's correct.
Why do you have to do that?
To help get the blood sugars, the sugar into the cells and not stay in the bloodstream, because the pancreas isn't producing the insulin that it normally makes.
And so if that stays in the bloodstream, it gets all sticky and builds up.
It can cause a lot of complications down the road, just like Debbie mentioned. So it's very important to keep that monitored and under control.
And what are some of those symptoms of diabetes? How do you know you have it?
Well, a lot of times you might have a lot of thirst, hunger.
Well, wait, I do that all the time. I'm always hungry and thirsty.
Feel very fatigued, urinate quite frequently. Vision may be blurred, symptoms like that to look for.
And it's not that, I'm aging and I need glasses.
no.
These are severe symptoms that I would want to call my doctor.
Yes.
And
I mean, it can be kind of insidious where symptoms come on and you're not sure what's going on, but you need to seek medical help when you develop new symptoms.
it's not an emergency room situation though.
It can be. It could be, yes. If the sugar was high enough that it would be out of control to that extent.
And how do you measure your blood sugar?
Through a lab test, or you can do urine dips, but it's often done by a finger stick.
So you can do that on your own.
Getting a blood glucose, yes.
And then you have those little monitors I've seen advertised everywhere that you put a little drop of blood on it and it tells you what your blood sugar is
Correct.
in such a small amount.
Some take about 6 seconds to give you the result.
And what's a good level?
Between 70 and 100 for those fasting. Anyone fasting or anyone that has eaten, it would we'd like it be between or less than 150.
But I've heard of, blood sugar levels in the hundreds. That's
Right.
bad, right?
That's why you need to do some actions, take some steps to get better control.
All right. Now, Debbie, you had mentioned that there were, bigger portion sizes and diabetes is really just exploding. Is there any way to prevent it?
By exercising, watching your weight, watching your portion sizes, that will help.
Even if you have several family members that already are diabetic?
Well, sometimes the genetic thing you can't control, but there are many other things that you can control.
That sounds too difficult to do, though. That's a serious lifestyle change.
Well, to be healthier, I think, you have to embrace the things that you can control and go with it. The genetics you can't, but the other things you can.
All right, very good. You are watching Medical Minutes here on DMG TV2, and we will be back with more information on how you can control your diabetes or someone you know right after this.
For chronic sinusitis sufferers, the idea of going to the hospital for invasive surgery may deter them from getting help. But thanks to Dr. Kurt Guerin, ENT, those days are over. Dr. Guerin is the first ear, nose, and throat specialist in Northeast Ohio to regularly offer balloon sinuplasty right in the comfort of his own office in Dover.
Hi, I'm 1450 WJER's Bill Morgan, inviting you to join me on television Wednesday evenings at 7 and Friday afternoons at 5 for TV2 Sports Talk. Sports Talk is your weekly look inside high school football, volleyball, soccer, and more. Look for guest appearances from your favorite area coaches and players. TV2 Sports Talk, Wednesday evenings at 7 and Friday afternoons at 5 on DMG Channel 2 on Time Warner Cable.
Welcome back to DMG TV2's Medical Minutes here on Time Warner Cable. We're talking about diabetes today with two nurses from the Community Health and Wellness Program at Union Hospital. And Debbie Angel is with us and Beth Hoffman, and they are facilitators of a program for self-management of diabetes. The registration is coming up in September. The deadline to register is coming up in September. So we've been talking a little bit about what diabetes is and how you really do need to manage this chronic condition. But the program will help you do that, and it's a free program. So I'm going to start with you, Debbie, and tell me, what do you learn in a self-management course?
Well, there's many things that the participants learn. Actually, the Healthy You Diabetes Self-Management Program was developed by the University of Stanford, and it's sponsored nationally by the by the U.S. Administration on Aging. It's an evidence-based program, and it's small group workshops. It's 2.5 hours once a week for 6 weeks. And participants learn many techniques as far as dealing with diabetes, from fatigue to pain, dealing with high and low blood sugars, also called hyper or hypoglycemia. Often they have problems with stress and emotional problems like fear, anger, and depression. They can learn appropriate exercises for maintaining and improving their strength and endurance, healthy eating habits, appropriate use of medication. They gain confidence and new skills to better manage their diabetes and feel healthier. Learn better ways to talk with their doctor and family. A lot of times that's a problem and a difficulty with individuals with diabetes on how to convey how they're feeling and the symptoms they're having. And participants in our program actually make weekly action plans. They share their experiences. They gain confidence in their ability to manage their symptoms, and they help each other solve their problems. They encounter in creating and carrying out their own self-management program. The program is very effective in improving the healthcare outcomes and reducing healthcare costs. So it's an excellent program.
Well, let's get a little more detail. The first thing is this huge lifestyle change of watching your diet. That takes so much self-motivation. How do you get patients to pay attention to their diet?
Well, you need to start by writing down what you're eating. By actually having a food diary, you realize the portion sizes a lot of times are bigger than the recommended portion sizes. And a lot of times that's where people become...
Portion sizes to me are, microscopic. That doesn't make sense.
Right. So they're more aware of their intake, their portion sizes, and the amount of foods they're taking in.
And then what about stress? How do you reduce stress? You go into work, you're already stressed out.
Well, and that's what part of the program teaches, different ways to deal with stress, from distraction to, listening to music, to different kinds of activities that our program works on.
Just take a deep breath.
Breathing is very effective, absolutely.
And then what about your medications? Your doctor prescribes them and you just take them, right?
Well, it's important to discuss with your doctor so you have an understanding of what medications you're taking and why you're taking them. And, and if you have a problem with your medicines, you need to discuss that with the doctor. So he knows what you're having difficulties with. If you're having some symptoms, if you don't tell him, he's not going to know.
Symptoms like we were discussing earlier, the blurred vision, the pain, that kind of thing.
That's correct, yes.
So what if you don't take your medications? What happens?
Well, you can run into a lot of problems, as far as if your blood sugar goes up, you can have kidney problems with your eyes, all the things like Beth mentioned. So it's very important to get that hemoglobin A1C under control.
Now, another aspect of the program I found really interesting was talking with your friends and family to get them to understand your diabetes. How difficult is that?
You have to start in small steps. Some people may have trouble communicating how they're feeling, so you need to make small steps and work towards communicating your signs and symptoms with your family and your doctor. If you don't tell them, they're not going to know how you're feeling.
Well, some people don't like to share information about that. They don't want people to know that they're trying to manage that diabetes. Right. You have to overcome that and say to your family, please support me in helping me take my meds, helping me make sure I make good choices for diet, right?
That's correct. And that's what this class teaches, the workshop teaches, is self-management.
What are some of the questions that the people in the class ask you?
If it's anything as far as specific with their medications, we refer them to their physician. If anything in the class is something different than what their physician has instructed them to do, if there's any discrepancies, we always refer them back to their physician to clarify anything.
And do they actually follow through with that?
All we can do is make suggestions on what to do there. So.
And the class, generally everybody finishes and they're happy with the results?
Yes, absolutely. Like I said, this is an evidence-based program from Stanford University, so many people, it's across the country, have went through this program. So it's very successful.
Now, Debbie, you work very closely with Beth Hoffman here, and we've been talking about the program itself and everything that people get to do and learn in the program, but there are some things that you have to take care of, like registration. Beth, how do you sign up for the Diabetes Self-Management Program?
You can register on our website, www.unionhospital.org, and click on the events calendar and go on the date September 18th, and you can register that way, or you can call the Community Relations Office. It's 330-602-0778.
And how many people do you have room for?
15.
Do you typically fill the class pretty quickly?
I'm hoping to, by getting the word out.
Now, this is a free class. How is it free?
Well, through the grant that she mentioned. Healthy U offers free programs, and the grant is going to pay for living a healthy life with chronic conditions. They also get a light lunch afterwards. They also get a hemoglobin A1C pre and about 3 months after the course completion.
That's a blood test.
Correct. It's kind of it's a finger stick. It's non-fasting, and it's kind of a look backwards 2.5 to 3 months at their mean blood sugar. It takes in consideration the highs and the lows, gives you an estimated average glucose.
And the program, we mentioned how to register online, but it's held at the YMCA in Dover.
Correct. It is. It's every Thursday starting September 18th. It runs for 6 weeks from 9:30 in the morning until 12 noon.
So this is a daytime program, but it's once a week?
Once a week, every Thursday morning. And ending date is October 23rd.
Now, we've mentioned many times this is a free program because of the Healthy U grant. Also, United Way having a grant, that's Tuscarawas County?
Actually, the grant, yes. United Way through the YMCA.
And how'd you get to all this coordinated? This sounds like a lot of work.
Oh, that's what we do.
And how important is this to you to make sure that people in our area manage their diabetes?
Very much, very important, because, I mean, I don't know, most people are affected either personally or have a family member or a close friend with diabetes. It's, like Deb said, growing rather epidemically in numbers over the nation.
And this self-management program, it is for people with diabetes rather than their family.
For adults with diabetes, pre-diabetes, and also anyone, any individual that's caring for a diabetic in their home.
All right, all good information to take home. Can they contact you after the class?
Sure, they may. We'll be having upcoming classes. After this is completed, I'm sure we'll be offering it again. That date is not known at this time.
Is 6 weeks long enough to get all the information in?
Yes, it is. And it's very interactive. Once the group starts, they seem to form a very close bond with each other, because there's a lot of sharing and a lot of interaction between the participants.
Even afterward, I imagine.
We leave that optional. If they'd like to exchange phone numbers and continue to call for support for one another, that's fine. That's encouraged.
Now, you mentioned phone numbers and websites and all kinds of ways to sign up for the Diabetes Self-Management Program through the Community Health and Wellness here at Union Hospital. And with us here on Medical Minutes has been Debbie Angel and Beth Hoffman. They are nurses running the program, and give them a call at Union Hospital to sign up. It starts in September. Thanks for joining us here on Medical Minutes, DMG TV2. I'm Jennifer Clark.
A nursing home or your own home? It's good to be home, so call Ember Complete Care for all your home health needs. When you're recovering from illness or injury, our compassionate staff promotes healing in the most comfortable environment of all, your own home, for skilled nursing, physical therapy, wound care, and more. Locally owned and operated, Ember Complete Care has been servicing all of Tuscarawas and Coshocton County since 1986, with a yearly average of $75,000 donated back into the community. Call 1-800-462-0909. Ember Complete Care. It's good to be home.
Hi, I'm Elaine Miller with Naturally Green Cleaning Service. My company serves both commercial and residential clients. We do general cleaning, spring and fall, empty homes to get them move-in ready, and final cleans for new construction. We use eco-friendly cleaning products that leave your home or office fresh, clean, and safe for you, your family, pets, or coworkers. Our focus at Naturally Green is to provide excellent customer service paired with outstanding work to build a relationship of trust with you, our clients. Having served the area 4+ years, we have had many referrals and testimonials that you can access on our website at www.naturallygreencs.com. Our work sells itself, therefore we have never had any contracts even with our largest commercial accounts. Call us today for your free quote and see what makes our company stand out.
Welcome back to Medical Minutes here on Time Warner Cable DMG TV2. This time around we are talking with Dr. Adam Myers. He is with Myers and Miller Podiatry in Dover. And we've been discussing diabetes and management of diabetes throughout this segment. And this time we want to focus in on feet. Obviously, a podiatrist, we want to talk about feet. For a diabetic, their feet are especially sensitive. Why is that?
Diabetes has a lot of manifestations in the feet between, they can decrease circulation, it can decrease sensation, and year in and year out, the #1 complication that across the country that gets diabetics admitted to the hospital is diabetic foot complications.
So that's neuropathy?
That's neuropathy, yes. Through mechanisms that aren't completely figured out yet, you lose sensation in the feet to the point where you can lose pain sensation, and that can lead to chronic ulcers and infections and problems.
Do you not realize that your feet are asleep?
You really can't feel pain. I've had a patient, for example, that had a screw come through his work boot and found it hours later when he was getting ready to shower and saw the blood on the sock. You can go completely anesthetized, basically.
So what signs do you look for?
In a diabetic foot, when somebody comes into my office, I'm looking for how good their circulation is, their pulses. And then we have a special little fiber. It kind of looks like a hairbrush bristle. And if you can feel that, you should be able to feel pain. If you can't, then you probably won't, and you're at the increased risk for the ulcers and the amputations. The best thing a diabetic can do is make sure that a trained healthcare professional, be it their family doctor, myself, some diabetes nurses, somebody's checking their feet at least once a year, more often if they're found to have complications.
And when they do have problems, what can you do about it?
When they do have problems, it depends on the problems. If they're developing diabetic sores, then it's coming to see somebody like myself at the office or I work at the Wound Healing Center at the hospital as well. You have to reduce pressure, prevent infection, provide a healthy healing environment for the wound. If the diabetic neuropathy leads to pain, there are pain medications from myself, family doctors, pain management specialists. It just depends. There are a lot of different complications that could happen.
And would you lose appendages as well?
You can. When you lose the feeling for that, it's called the Semmes-Weinstein monofilament that kind of dictates when you can feel it, or kind of that helps us understand when you can and can't feel pain. Your chances of an amputation go up about 17-fold.
So do you just lose one toe at a time, or does the whole foot come off?
Depends on the situation. I've seen people lose just the tip of a toe. I've seen people lose the entire leg from the first ulcer. It just depends on the severity of the ulcer. Does it get infected? How much blood flow do they have? When do they seek treatment? Do they wait weeks or months before they show it to somebody?
So it all comes down to just take care of your feet and pay attention.
Yeah, but first thing it comes down to is control your blood sugars. That far and away, whether it's the eyes, the kidneys, the feet, and then after that, inspect your feet every day and seek help immediately if you see something unusual.
So as we're talking about diabetics, making sure that they especially check their feet, we're about to go back to school.
Yes.
So the rest of the population, parents are getting new shoes for their kids for school, their new gym shoes, their new good shoes for school. What should parents look for in a shoe?
Shoe fitting across the board, children or otherwise, you want a supportive shoe. A couple ways you can assess that. One would be if you're picking up the shoe and grabbing the heel and the toe, how easy does the shoe bend and where? You want the shoe to bend relatively easily out near the toes, where the toes are supposed to bend, not in the middle of the foot by the arch. You want to take the back of the heel, called the heel counter, and squeeze that and see how stiff that is. The stiffer it is, the more support it offers. And then also, if you're grabbing the toe and the heel, how easily does it twist? You want a little bit of twist and give, but it shouldn't be really floppy and flexible like a flip-flop. And
a lot of
after
kids
that-
wear flip-flops
a
to
lot of
school.
kids-
Are they supportive? They
No,
don't look it.
They're not supportive. Flip-flops are great for my business. Not so great for your feet. They're not very supportive. Certainly a lot of young people are healthy enough they can get away with that more than as we get older, but they're not a supportive shoe. They're not particularly protective.
So we're looking more for function
We
than
want
style.
function, yeah, and usually a name brand athletic shoe, particularly the running style shoes, offer good support. And then it comes down to fit. I really take advantage of professional shoe fitters when you can, as far as making sure that the shape of the shoe matches the shape of the foot, that there's enough room for the toes, that it's not so big that it's slopping up and down on the heel.
Well, sometimes you think, oh, I should get a bigger shoe because the child will grow throughout the school year.
It is tempting to buy a shoe that's a little bigger than you should have, but if the shoe's so big that you can stick a finger down behind their heel, that's likely to slide around and lead to things like blisters and problems like that. So in the long run, it may cause more problems than money saved.
Now, what if it's too tight? What happens?
It-
Their
it-
toes curl up?
Too
and-
tight, you're going to see pressure on the toes, corns, blisters, and conditions like that. In children, if a diabetic were to do that, that's where you can lead to the diabetic ulcer. So it's, like I said, the appropriate fit and form of shoe, function of shoes is important across the spectrum.
And can you tell when patients come in that they grew up with shoes that were too small?
I think it's a common misconception that too tight of shoes led to hammer toes and bunions. Tight shoes will aggravate those conditions, but those are generally speaking inherited conditions. So
And what's the difference between bunions and hammer toes?
bunions are when the big toe points out and you have a lump on the inside of the foot, and hammer toes are just any crooked toe, smaller toe.
Can you fix those? Do you need to fix those?
If they hurt and cause problems, yes, you can fix those. Typically it involves surgery. You first try to get shoes that are a little bit bigger and don't rub, but there are options if they become painful.
Now, sometimes style dictates a little bit of pain. I know a lot of women like to just endure it.
We could spend a few hours debating that one in and of itself. Function first, fashion second is my opinion. But yes, it's a tricky thing, particularly for ladies who are professional, trying to find shoes that look appropriate in the work world, but yet accommodate whether it's bunions and hammer toes or provide the support they need to be on their feet all day. So sometimes we compromise. When you're not actually being seen by the public, you wear the tennis shoes, and then for the meeting at 2 o'clock, you slip into the dress shoes.
What about the inserts that you can get? They're cushiony, they're jelly,
Right.
Those kind of help with the pain.
Certain insoles do help. It's a question of what condition do you have as to whether you want a gel insole or you want something firm for support. So they all have their merits. It's just a matter of trying to match up your needs with the right over-the-counter insole, but we often recommend those.
All right, when you are looking over the counter, there's so many to choose from. How do you know what your condition is?
That's tricky. At that point, you're probably better off getting an assessment than just spending $15 here and $20 there.
There are little kiosks
the
that you
key-
can
the
stand
key- I
on,
was
and they'll
gonna say,
tell you,
the
here's a
key-
$50 insert
The
to buy.
kiosk at Walmart, I'm sure has helped some people, but it's a little bit more of a guesstimation, I think, sometimes when you're doing that. And oftentimes, like I said, a trip to the podiatrist can steer you in the right direction and sometimes even save you money, because sometimes instead of that $50 one, there might be a $20 one that would have worked as well or better.
All right, all good advice. If you have any questions, I'm sure your patients call you all the time.
Absolutely, absolutely.
Great. Dr. Adam Myers, we've been talking about feet, not only in diabetics, but getting shoes for kids for school, and of course, fashion versus function. Thank you for being on Medical Minutes.
Thank you.
And for DMG TV2, I'm Jennifer Clark.